Welcome, welcome. All right, 4:03. We start on time. Um, this is the final public meeting of our 2025 terminology development process. We are going to have the consensus vote on our 3 community meetings we've been working on for some time. Minimal slides, because if it's not new, it's not here. Next slide. Thanks for joining us. We are likely a smaller community today. Everyone's muted, but if you have questions, please feel free to unmute and chat. All calls are recorded and recordings are available on the Gravity Confluence. If you have any questions, you can put them in the chat to everybody, and please send any chat to everyone. Again, there's not a ton of material today because we really wanted to force folks to go to the masters to review the content that the team has put there for your review. Next slide. As part of our ANSI accreditation, we are required to follow and comply fully with federal and state antitrust laws. And so anyone speaking has to refrain from a discussion which might provide the basis for an inference that they've agreed to take any action related to prices, services, production, and allocation of markets, or any other matter having a market effect. This is the part of the requirements of being an open consensus initiative. So no one can discuss pricing or others' pricing or any terms that might affect pricing. And we don't just directly adhere to these guidelines. We try to avoid anything that might be construed as an antitrust violation. Next slide. Okay, very brief announcements. And then we have 4 topics we're voting on today. In our work to address community level domains, we have new concepts for our intervention framework, and we always reflect on, we try to think about additions carefully. And so we have a couple things there, really 3 concepts there. And then we're going to go through our neighborhood safety, food access, and access to green space consensus vote. There's actually a missing thing, which is like a cross-domain additions as well, but lots of that is threaded throughout. And then we're going to have the voting vote poll. I'll put it in the chat, and folks can vote either in real time or they can, hold it and send it in by end of day tomorrow. And then we'll close and talk about next steps and talk about how we're going to be seeing you in February again. Next slide. Next slide. So this is our final meeting, I just mentioned. We enter our winter build time after today, which is when all the elves get really busy submitting concepts into terminologies that you all have enacted and enabled through the consensus process. We reconvene publicly on February 5th, and we'll be doing our every other week cycle at that time. Our spring domains are legal needs, child abuse, and non-elder vulnerable adult abuse. The latter 2 being outgrowths of our interpersonal safety work that we started a few years ago. And we are accepting recommendations for subject matter experts for those spring domains. It is an interview process. So any CV that you want us to review, just send to gravityproject@hl7.org and we will review it. You can self-nominate or nominate others. And again, legal needs, child abuse, and non-elder vulnerable adult abuse. The technical work stream is in a fun, exciting spot as well. So their meetings meet from 1 to 2 Eastern Standard Time. The draft ST 3.0 is available for review. There's a really cool critical meeting coming up on December 3rd, which is that report out and ballot prep. So we really want folks to come to that meeting to talk about a general view of the IG and prepping for ballot and member engagement in that. And then the implementation work stream, we just had our final meeting of 2025. And very soon you can catch the recording on the Confluence, which was a focus on payer perspectives and leveraging Gravity standards to address value-based care principles and outcomes from member Highmark. And Highmark is actually one of our founding members. They've been here since the beginning. And it was a really great presentation. I encourage everyone to see all the terminology that we create here in action. And then we had a fun roundtable on ROI with members. We had Two community-based organization members, Elena Kalinowski from CIE San Diego and Esther from Partners in Care. She's both a direct care and a community care hub purveyor, or actually role, I should say. And then we had colleagues at Unitas and Find Help. It was great. We had a great time. So you can catch it on the Confluence when the recording is available. And then we have, next slide, we have a couple opportunities. Next slide. Oh, this is I already like literally just said this. My apologies because I'm tired and I've been talking for a long time. So we are seeking subject matter experts for upcoming domains. Send the emails to gravityproject807.org and we review CVs as part of our due diligence and evidence-based nature. Again, those three domains of reference: legal needs, child abuse, and abuse of non-elder vulnerable adults. Next slide. There's two member-related opportunities, so we try to highlight cool things in the ecosystem when we can. American Medical Association is a long-standing and very valued member of Gravity, and they have a new grant opportunity, which is Community Health Impact Lab Micro Grants, supporting physician-led initiatives aimed at improving health outcomes at the community level. And so you can goals and expected impact are improving community health, encouraging innovation, and identifying scalable ideas. There's going to be 20 grants awarded, and the grants are $50,000 per recipient. Next slide. And then our amazing friends at AHIMA, who are experts in all things on how we do what we do, have published a draft white paper called Building Patient Trust in the Collection, Use, and Sharing of SDOH Data. And we thought you all, as interested parties in the creation and utilization of SDOH data standards, would want to comment. The white paper proposes a 9-step framework that can be used to build trust between patients, care teams, and health information professionals who operationalize and maximize our ability to collect, use, and share SDOH data. And again, the comment period runs through January 16th. And again, these slides will be available after the call, and you can have hyperlinks. We're a tiny team today, and you also can look for it. So we don't have a ton of hyperlinks because one of our members is out of office today. Next slide. Any questions on those announcements? We are about to enter a classic consensus vote, fairly brief and content call. Next slide. Oh, sorry, I have to do the highlight stuff first. Don't forget. Gravity Project. We are a collaborative initiative with the goal to develop consensus-driven data standards to support the collection, use, and exchange of data to address the social determinants of health. That's who we are. Next slide. I just mentioned our members. You'll see them here. You can see Highmark with that star, meaning that they're a founding member. We wouldn't be able to do what we did without all of these amazing folks helping us support financially and support with their expertise, everything that we do. Next slide. Here we are at the end of our schedule, 11:20. Consensus vote on our 3 domains. The only homework you have is submitting your vote. Next slide. All right, and so this is where we're going to level set. We sent emails. We talked about this last time we were together. The thing we are voting on are the master slides we posted on the Confluence on Tuesday, right? That's where the content is. There are very little changes from those master lists from the last time we presented. And so the last meeting we had was the bulk of new content. The only thing we're covering today, really to honor and respect that the master is the master, and there's no way we can review all the content on those 3 masters in a call. We're only focusing on updates. So those master lists that were posted on Tuesday are the source of reference. Next slide. And then again, we're only presenting things that are new. We say this every time. It's especially important today because those masters are comprehensive collections of everything you've identified across instruments, diagnoses, goals, and interventions. Too much to put on the slide deck in one day. Next slide. And then there is a caveat, and Jonathan, I'm thinking of you when I say this. There's been, I want to call in something that you'll see everyone saw on the master and that might have some flux, right? And Bill, this actually is in relation to a comment that we've received in N10 review as well. When I was reflecting on the themes from this cycle, we've been very careful to have like micro, meso, and macro interventions. Been very careful to talk about how we have to center communities throughout the process. We've also been really careful to try to ensure that rural communities were represented in all of our solutions and all of our problem statements. And we originally, when we first started, we used the word community, and then we reflected that maybe neighborhood was a better word because we had yet to define community. But then when we sat back as subject matter experts and the terminology team, we realized, and we did this field testing, that neighborhood was not clearly representative of rural communities. It wasn't, they didn't see themselves in that concept, and that gave us pause, right? So we originally started with community as the concept. We shifted to neighborhood because we didn't have a clear definition for community. And then we went, wait a minute, like rural PCP, rural girl who grew up on a farm. I did not grow up in a neighborhood, right? I grew up in something different than a neighborhood. So you're going to see, all of you saw shifts on the masters on Tuesday about how we name where people are living. So when appropriate, we use the word community as defined in the definitions, right? And there's definitions for what we mean by community, which is really the geographic space where people are living, in every single place when we use the word community. So it's defined. And when we did not feel that the word community was appropriate, we used concepts in either residential geographic area, which is very science sounding, but it's exactly what it is. But we also use the term environment when appropriate, because for some of our access to green space concepts or access to natural environment concepts, I should say, environment was a really appropriate word to use. This is, and again, this is not, this is, has been, these trends you can see on the master lists on Tuesday, new to some domains, not new to others, but really trying to make sure that we pulled in and gave great. I love that. Thank you so much, fellow rural friends. So part of end-to-end review before we go into vote is again sitting back and looking. And we did not want to build concepts that weren't representative of all of the places where people live. And so you would have seen that. You'll see all of that on the master list. It's too extensive. Exactly, exactly. Yeah, and we're talking about like the geographic community, so the belonging stuff is a little bit tricky, but just noting that thanks everyone for your patience. Um, there's might be a couple word shifts that you see in addition as we go forward, like in neighborhood safety, we're still there, like we're nuancing the consensus of what the best path is there, but the meaning won't significantly change. And Bill, thank you. Bill's been a great advocate for rural perspectives along the way, and we appreciate you. So the core meaning will remain. Again, it's all from a diligence perspective. And so great, fantastic. Thank you. Okay, so again, we're not highlighting all the shifts because it's really just in most instances taking out neighborhood and putting in community and noting that we actually define community in the definition of the concept, unbeknownst to ourselves. We did that when we created all the definitions. Okay, any questions on this? It looks like everyone agrees and says, oh, that's very appropriate so far. Great, go team. And we addressed by design the need to define community, so that early concern was addressed as well. Go team. Okay, next slide. Yes, and so community, that's why, so in general, well, it depends. Community has multiple different purposes. Community, for the purposes of our work, is about the geographic place where you live, and that's appropriate to the literature. It's how it's used in topics like community safety and community food access and community food security. So we felt comfortable grounding ourselves in that use of the word and defining it as the geographic space in the definitions, given the complexity of finding additional concepts, unless we literally are using other words. And those of you who like for on the masters, you can see we don't always use the word community, right? Sometimes we use residential geographic area, or sometimes we use the word environment. Yeah, Mark?
So, not to take more time on this, but that this is an important concept. Do you think that communities can overlap in geography. So a single census tract, for example, as a geographic definition, could have multiple communities in the same census tract.
Yes, but we also have we have different levels of measuring the geographic area that's required. That's
Hmm.
a note, right? So I think that's
Right.
okay, right? It's like because we have census tracts, census block groups, we have, my neighborhood, and so one of the things we're realizing as we think about defining things is,
Mm.
there's precedent for using general concepts and then just using additional
Yeah.
variables to be more clear. And we feel like that's kind of what we're going to have to do, right?
So my block in Oakland has multiple communities, the single block. Um, and so as long as this has been as long as we're using a term that applies for this particular usage, that seems fine. That's why I said in my earlier comment in general usage. I don't know how you see how the team sees this with respect to the current codes.
Well, I think the definitions help here, right? So like there are um yeah, I'm hearing what you're saying. But again, we already are in a spot where we're using multiple different geographic areas of reference depending on what's being measured and discussed. And so I feel like the openness of that is appropriate. I don't think neighborhood's any better, Mark, honestly. Right. I don't think it's actually any clearer than community. Do you?
Mhm. Probably not. I
Yeah.
guess I know we're at a vote. In the back of my mind, a question is, does this need a little more thinking? And we probably don't have time for that. But this is not crystal clear to me at this point.
Oh yeah, so I want to note that when it comes down to describing what actually is being measured and discussed, like there's additional levers you see in the definitions and concepts themselves that are not contained on this slide, right? Um, we need to define what a census tract is. Help.
Yep, you
I mean,
do. You need to define it. I don't see it defined in any of the referenced material.
oh, okay. So we want to bring in the definition of, because we don't need to define it. It's defined, right?
You tell me.
It is, yes. It
Okay.
is. It's a unit of measurement. So that's partly, I guess, part of the
It's not a unit of measurement. Sorry, it's
what?
not. It's
It's a
not a
geographic.
unit of measurement.
It's a geographic
Rob, it's
defined
defined
area.
by the Census Bureau and
Yeah.
has been since at least the 1930s, if not for 100 years.
So then we need to have that reference to whatever that definition is that defines what a census tract is.
Oh yeah. So it's in the Food Access Research Atlas materials.
No, it's not. I just looked.
Oh, so okay. So
It may, I think like what you're doing, you're presumed it to understand what it is, but I don't see it defined inside the reference in USDA.
okay. So
So
we
we
can
need to
pull.
go and find a place where it's defined if it's in, you know, the Census Bureau or something, but it's got
It
to
is.
be a
It is
defined
defined
thing.
in the USDA materials. I can absolutely promise you that, right? And so we can pull that in. So
Okay.
that seems like we only use the word census tract. We use it in two different concepts, right? I think. So are you advising that we,
Well, we use it as a measured entity, what's being measured, right?
yeah,
In the food domain, and we probably
yeah.
use it in the neighborhood safety thing, I guess.
We
I would
use it
say.
in the access to green space comment because there's one of our concepts that is a census tract measurement.
Yeah, anything that's like, here's a group, and then do you have access to is going to presumably have this idea of the census tract. But
Yeah.
we need to say,
All of these units so community is and neighborhood are the loose things. Census tract, census block group, county. They're defined and we can easily bring those in.
Okay, yeah,
Yeah.
good. So
Yeah, I
we
don't
just
have to
need to
define them,
reference it.
luckily. Yeah, I don't have to define them, and we can bring. So that's like, Rob, would that be a vote with a comment? Because we can't do that now, right? That's a
Right. Yeah, no. It's going to be a vote with a comment.
awesome. Okay, great. Wow, and I'm grateful that you all are because we're so close to it, right? I'm like, oh, that's a fait accompli. We did that. But apparently we need to offer more clarity for that, and my apologies. We will do that. Lucy.
Yeah, I just wanted to respond to Mark, maybe, and that is to keep in mind that measuring social determinants of health and their incidence and prevalence is ultimately connected to connecting people to what they need. And that, to me, implies that they're on a place on this planet, and we're just trying to get the best way to refer to the place that they're on this planet, not communities that they may feel they belong to through internet connections or other possible ways of defining who I am. But our ultimate purpose is to say there are needs here in this place, and people need to be referred for services if there are any. And if there aren't any, we need to get some. And that, to me, all refers to a location on the planet.
Thank you, Lucy. Any other thoughts on the geographic residential area thoughts? And again, thank you so much for these. These are really good. Like, if there's something that remains to be defined, this is a great place. This is partly why I said dot dot dot. Like, this is a great thing for a comment on the deliverable. And in Rob's case, it's very easy. So I know where those definitions are. I can just bring them in. I don't have to define them. I can just bring them in. That part's easy. If someone else has a like a cogent example, then voting with the comment will help us be accountable to resolving it. All right. Any other thoughts? And I'm glad that your question was one I could actually answer easily. In the like, of all the questions, sometimes the questions are not so easy. All right. Any other thoughts before we move on? Okay, next slide. So this is the intervention framework that this is one of the items we are voting on today. So we're voting on master list for the domains, and we always try to elevate when we're changing our base materials. And with your, consensus, approval, and agreement and coaching, we realized that actually to do kind of the macro level interventions, right? We had that presentation where we talked about micro, person level interventions, meso, group level interventions, and macro or policy systemic interventions. Our existing really micro focused intervention framework, which is focused on interventions for people, was not sufficient. And so we have been socializing with all of you for some time, two distinct concepts, which are develop and maintain. And those have been stable for some time with all of you. And then akin to evaluation of eligibility, engagement as an intervention specifically aligned with community. But we could know very well that patient engagement is also activity of reference. We just don't have it here. Lucy?
Yeah, Sarah, my understanding of intervention framework is that we are trying to categorize activities that people in contact with consumer patients do.
It's like it's like verbs that help.
Yeah, I'm adjusting, I'm assisting, I'm coordinating. So I'm a provider, okay? Are you asking me eventually to code that I am engaged in activities that build or strengthen community capacity? who do these intervention framework categories apply to?
Population health entities in every health system do those things all the time, right? The actor is the person, sometimes it's a person, sometimes it's a system, but it's to benefit a population. And
Well, that's a really idealistic statement because I'm not sure that all health systems do this at all, not to mention all the time. So
You mean
this is
develop?
going to actually be coded by some I don't know, discharge planner filling out what has been done for a patient. They're going to check all these things.
Oh, remember, we create things that can be documented, but it's not that I mean, help me understand your question.
Am I the only one not understanding this?
Well,
I'm a
it's not
provider.
new.
Lucy, sorry to interrupt. I think this goes back to
Please.
a comment that I had asked a couple of weeks ago. Who is the end user for which specific part of what they have access to? So it's almost tantamount to where does this information live? How do people get access to it? And who is it designed for? Because when I
Yeah, so that's why we talked about the micro, macro, and meso level interventions, right? Is that this is work that happens in clinical settings all the time, right? So again, we don't predetermine, we had to, in addressing community domains, conceive of non-micro interventions. Otherwise, we aren't accountable to macro solutions. But the point of, again, I mean,
Well, there's no question, Sarah, that all of this needs to be done. I'm just trying to connect these verbs and these definitions with what I know has always been done for hundreds of years to improve life.
So
And lately we say improve population health or
the
whatever.
question about one of process, or like, is the work happening, or is the work going to be able to be documented?
Where is this work happening?
Oh, this work is okay. So
This happens in philanthropy, in government, in community organizations of all sorts. But are nurses doing this?
yeah. Like
No
Asha,
nurses that I know are doing this.
Asha, my lovely colleague who doesn't, she's a community health nurse specialist. That's her jam. This is what we do. Right? That's why we had like social work. That's why we use the social work model, right? I know the process is not aspirational. The process happens. The documentation might be a little aspirational, and I admit that. There's not a ton of concepts though. But the work happening is the work we do. Developing, maintaining new programs and engaging communities. Like community health needs assessment, that's a mandate from the Affordable Care Act, right? That is all about like macro level assessment, community engagement, community planning, developing and maintaining community level programs. And that's mandated by CMS.
Yes, I know all that. I'm trying to, well, I just can't connect this to screening. Okay, maybe
Okay.
that's my problem.
Oh yeah, but that's why it's hard. Maybe we shouldn't have put it on one slide, because on this slide are micro level interventions that are focused on just one person and macro level interventions that are focused on communities.
Why don't you divide these up and use different colors or a different
Okay.
typeface or something so
We
that
can do
it's
that.
clear?
Yeah, so the intent of this slide was just to talk about the verbs. We're adding
Okay.
yes.
Well, these are great verbs, but I just am having trouble putting them on a screener
Oh
questionnaire.
yeah. Oh, but they're not in a screener, they're a response to a questionnaire, right? So let's think about some of the instruments and data sources we have in our work. We have community level assessments like the USDA Food Security Toolkit, or the NEMS measure, or the UK Access to Nature measure, right? Those are assessments of large places.
Yeah,
And
but this is going into coding, isn't it?
Correct.
how is SNOMED going to deal with this?
How is SNOMED going to deal with
Somebody on the call from SNOMED, could you tell me how are you going to deal with this?
deal with? So I'm having a Lucy. I'm sorry if I'm not understanding. We're talking about process and we're talking about codes at the same time. Corey, do you have thoughts?
Yeah, I mean, I think Lucy, if I'm understanding you correctly, I think you have asking a question that I've often asked myself, which is, so we're going to screen an individual about their access to green space, for example, and they're going to say, I don't have access to green space in my community. And then there are interventions that are sort of the macro level interventions that for which we're developing codes. And I think, Lucy, one of the questions you're asking is who expresses and documents those codes about the macro level interventions, and where do those codes live? I'm not sure. Maybe I'm misunderstanding your
No,
question.
that's exactly right. And then who's accountable for acting on them?
How does that
Thank
relate to
you.
screening questions? I mean, I guess I'm a little, um, okay, so help me understand what we need to collectively get to.
I think it is a process thing, Sarah. I mean, I think the point is we have questions to screen about sort of community things, and we have codes to document and to express things that can be done in communities. And I think those are probably all fine from my perspective. It's just a matter from a process perspective, where do
Now,
those macro level interventions um, live and get used in common practice, which is not really our job here today, I think, but I think that's what I hear Lucy saying.
yes, thank you, Corey. You know, Sarah, you could add regime change to this. Regime
Wouldn't you like
change,
that? But
well,
civic
I
you're
mean,
the advocate for
that,
civic muscle, Lucy. Don't leave me now. Come on, that
okay,
was a great
so
joke.
let's end this and I've expressed my problems and we're going to vote on this and then we have to maybe come back to this and figure out who are we addressing by even thinking that any of this has to be coded. Okay, let's leave it there.
What? Okay. If we're asking that question at the end of a 4 month process, I'm a little confused. I have to be honest. Right? So I don't know if I understand that question. And I'm worried about country. Country, are you also maybe I'm tired. Maybe I've been talking too much today. Um, but so Lucy, can you repeat what you just said? Because I just want to make sure that we're not like leaving. Um, we've been talking about like community
You're all
level.
right, Sarah. You and all of the SMEs who are constantly dealing with this are expressing something that you want to consider as an intervention, and that's fine. And maybe we have talked about this before, and I wasn't paying attention. I'm just I'm just going to leave it there. I don't understand who is accountable for engaging in these activities. I'm just going to leave it at that.
Okay, so
Okay,
I hear you.
that's it. Okay.
Okay. Okay. And I don't know, I mean, I must admit I must be tired because I'm not quite understanding, but the there is the actual work that happens and then there's the codes to represent that work. So the actual work is happening. That part is not in question. Um, the codes to represent that work and how they're function, I think we have some work to do there, maybe, but certainly it's our responsibility to name the things that systems and communities are doing. And maybe we'll, we have, um, okay, I see Sue there. Um, oh, okay. Lisa's asking for to help to show the slide and displays the activities, assessment, screeners, diagnoses. So we could do that. Well, I'll make one. I can't do that today. But if we think about, I'm just going to do the cycle. So we have a community assessment or community data source. We have the community food, so Lisa's talking about that wheel we have with the codes, right? So we have the questions and answers from the community food access instruments plus observations in census tracts. Thank you, Rob, for finding that, right? These are findings of the communities and places where people live, right? My community has not enough vegetables in the corner store. I live in a low access census tract, right? So that is up in the top corner where individual screening instruments used to be, right? And then we have some screening instruments of people as well, but a lot of the time we're assessing communities, right? And then the diagnoses are findings of the community, of my community, and sometimes how I feel about it, because we do in some of them, like in the neighborhood safety, there are feeling questions. They're findings of communities and people's interactions within them. And so sometimes they're clearly a finding of am I making sense? Or is this helpful? Regardless, and then we have community level goals, like where we're going. And again, that kind of goal setting. The findings of risk of communities, that's core community health needs assessment work. That's what we do. What are the risks in my community that I'm living in, right? We even use standardized instruments to get to that. And then the goals, we do that with community health needs assessment as well, right? Aim for where we want to see, like how we want to improve outcomes. And then interventions, we have interventions both for the person living in that community, how I'm helping the individual, but we had to create interventions that are how we do the community level work for the population entirely, for the group, right? Because the whole point of community level needs is one-off interventions do not solve the problem. We had to go higher, right? And that's how we got here. At least I don't know if that was helpful. Okay. All right. Are we doing okay? Are we feeling okay? Maybe everyone's stunned to silence. All right. Here we go. We're gonna keep on going. And okay, oh, look, John Rancor is here. Hi, John. Love it. Okay, Tammy's good. We're doing good. Okay, good. Okay. Hi, John. How are you doing? Called
I'm
you
doing
in.
great, and
Hi.
thank you for all you're doing. Great call. Good to see everybody here.
Good to see you too, bud. All right, so next slide. Okay. Now we're going to go to community level universal domain intervention. This means like, and Lucy, this is when we start packaging information, and Jonathan, in sets that are relevant for person level interventions and macro level interventions, right? Because the things that we had across all of our domains for person level stuff are not the same as what we have for communities. And so there were some requirements we made. And we talked about this over the last couple meetings. Next slide. All right, so there's some updates, and stars are trying to represent new things. So these are all fundamental concepts. So we had some questions about accountable community for health last time, but we found such significant literature as this being the highest level concepts for multiple manifestations, of which the accountable health communities model is one. We stuck with it. We just have a whole bunch of more references to support that concept. And then really to represent we had this last meeting, we were talking about the ways we engage communities in designing solutions, the same ways we engage people in designing solutions, like person-centered care planning becomes community-centered care planning. So we have a couple updates in wording with community participatory modeling, which actually came to us from our friend Patricia Salibi, connecting us with other people who are leading this work in health systems and communities around the country. And then we had a conversation last time. You see the other stars on improvement district. Lucy, you called in the fact that business improvement district seemed a little out of scope, but we talked about the many times business improvement districts are used. We're actually elevating it up just to improvement district because improvement districts are built for multiple different purposes. And there was like a US level concept that talked about that specific without being just business. And so we brought it up there. And then there's no other changes on this slide. And we did want to call in community participatory modeling and improvement districts, though. Oh, great. Thank you, Tom. Thank you. That's helpful for real world implementations. We appreciate, Tom, you're always on the cutting edge, friend. Cutting edge. Next slide. And again, I have to apologize because I live in like Valhalla for this stuff in Vermont, where we're always like doing crazy innovative things. And so sometimes I have to be.
Sarah from Valhalla, can we refer to you forever
You
like
can
that?
refer, you can call me that. Someone
That's
else is calling me a
wonderful.
code farmer these days, right? So
Yeah,
that's
we're gonna make you a t-shirt
okay. That sounds great.
with a farm on.
Oh, yeah, exactly. That's yeah. Sarah DeSilva from Valhalla, the code farmer. That's Charlie Harp's new name for me. Okay, so there's a lot of new stuff here. So we heard you all respond to the need for health districts. We actually really loved this concept because it's cross-nation references for how it, and this is just about healthcare service provision. It's how regions organize themselves to deliver service like healthcare services, everything from urgent care to hospital-based care to primary care to mental health and like substance use. So health districts was what elevated out of that conversation we had last time. And some critical programs and professions. Epidemiologists are important when we're doing this work. They are the people that create the data that we're responding to. We talked about ag extension last time. We're elevating that up again to the universal concept, which is cooperative extension system, which is like so cool. I mean, I got misty when I did cooperative extension system. This is the ways land grant universities partner with communities to do all of this work, like for the research and the community-based entities, like master gardener programs, urban farms, like free landscape design, like cooperative extension is one of the most beautiful things if anyone lives near a land grant university. And again, it's an all nation thing. We really tried to think about things that are relevant across the country. And honestly, in rural environments where we're resource poor, Bill, um, the cooperative extension system for any kind of community level improvement is really, really critical. We rest on it for the knowledge and expertise to deliver transformative services. City planning department is as a program profession. Farmer, yay! SMEs thought we couldn't do what we were going to do without farmers, so they're here, especially with food access. Forestry divisions are cross-domain access to green space, but also food access, because forestry divisions are also responsible for edible landscaping within city areas. And then the Parks Department. Again, Parks Department cross-domain relevance because of its role in access to green space and neighborhood safety. So those two domains were interconnected. Tom. All right. Whew. How are we doing? This is not as challenging. I feel like this is all these programs, professions make sense. Okay, next slide. And again, all of this was on the master on Tuesday. None of it's new. And so in the universal interventions, assessment is not a new concept, so it was not called out on the intervention framework. But engagement was a new one, so it was on there. But these are just things you're going to see. So the previous slides are going to become part of an all community value set of interventions, right? Just like we have an all person level value set where everyone gets referred to a social worker. Everyone can get referred to a community health worker. Everyone can get referred to a AAA, right? So in our current person level micro value sets, we have the things that are so common. We just put them into every domain, and we're doing the same thing here with community stuff. How are we doing? We're good? All right. This is literally the content for the day. Nothing else is new except for a couple concepts in neighborhood safety. Next slide. All right, so we are exploring what the best naming is here. This stays neighborhood here. Our SMEs are thinking about it. Really some lovely thoughts about community, how it's important. Like in the literature, community safety is very predominant. There were some concerns about using that concept really from calling it in and wanting to preserve it, which I thought was so lovely. But again, it doesn't change the definition. The definitions are the same. So we just wanted to say TBD because we want to coach our SMEs to consensus on it. Maybe we'll get comments we have to resolve anyway. Next slide. Next slide. So again, neighborhood throughout might change. Again, this is like the lamest slide, but it happens in every domain. Over the course of all the following slides, only new content's presented because the masters have been stable since Tuesday. So the only things that are here are things that changed, right? And it's important because it's already 4:47 and we're just getting to domains. All right. So if you want to review the masters based on this conversation, or you want to go back and look and you don't want to vote today, the survey is live until 5 p.m. tomorrow, Pacific time, to be kind to our Mark, that's for you. Lucy, that's for you. End of day Pacific time is when the survey is complete for the vote. So if you want time, you can go back and look at the masters and reflect and offer line by line comments. We love comments and we love adjudicating comments and getting thoughts back. Next slide. There are no concepts. There are no new concepts and diagnoses, so we didn't have any updates there. Next slide. There are some new updates and interventions. The bottom one's the easiest one. We'd yet to come to agreement on request for order of protection. However, if we can remember the beautiful models that we've seen over the course of our time, community safety realized model, just gorgeous work, and that was presented on by friends from the Prevention Institute. Anything that was a specific intervention aligned with the evidence in either that model or the CDC paper we wanted a concept for, it just took a little bit to get to agreement on the order for protection one, but it was called in as a specific means and method, so we called it in as well. It took a while to figure out the concepts in street outreach and crisis response that the SMEs wanted to name, because they wanted very clearly not just co-response. Well, first I'm going to step back. We couldn't use street outreach because it is a core concept in the homeless management information system, housing support data that already has a specific definition that is attached to homelessness. And so we could not disrupt that use. Even if sometimes non-law enforcement crisis response is called street outreach, our street outreach concept supports HUD to a T, and so we had to think different. And then we looked as terminology team and SMEs for some time, and really the best example of the concept that describes non-law enforcement crisis response that focuses on addressing reports of non-violent mental and behavioral health needs is the Holistic Empathetic Assistance Response Team, or HEART team. So you still call the same number, but the police don't come. Trained responders come as well. So again, this is different than co-response. With co-response, you have social work and police responding at the same time. But in this instance, it's just licensed mental behavioral health clinicians, and it's usually run by public health departments. So it's run by public health focused entities and not the police department. So that's important. And again, it took a while to get there, which is why it's here today. It wasn't, we just need to find a different concept than street outreach. Any questions on this one? Lots of examples around the country. We have a reference
So
here.
Sarah, this is Susan. You start thinking about these programs and then you start wondering, how are they sending data with each other, and do they need some kind of a document type?
I love that you're asking that. It makes me think of our friend Jonathan Fite, who we haven't heard of. Back in the day, Jonathan was a huge advocate for first responders in the health system, like ambulance and emergency, having access to this kind of critical data. And so it's a good question to ask whether we need an additional document type in the LOINC document ontology. I don't know. We can talk about that. Luckily, that's in a continual improvement project. Based on the 2 notes we already have. So we have 2 documents so far, Susan, right? We have community health worker note and social care note. Those are the 2 ones we added, but maybe there actually do need to be a different
And
type
you
of
had another occupation here too. And we'll talk about that offline, because occupation is another
Love it.
thing.
Great. Okay. Any other thoughts? All right. Next slide. It's called STAR. What does STAR stand for, Rob? HEART is the one that's used across the DOJ, so that's why we use that one. The Department of Justice uses that term. Rob, what
Yeah,
is STAR?
well, guess what? In Colorado, Douglas County, it's a mental health person with a police officer.
Oh yeah, so that's what we're not. We didn't. That's what we wanted. We needed to find an example of the program that was not co-response.
Yeah, well, that's what it is. The
Yeah,
HEART
our speeds
program,
were.
the
Yeah.
HEART, no, 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 no,
Oh,
you're not hearing me. The HEART program is police and mental health.
oh, in Denver?
Well, Douglas County, which is not surprising given what I know about Douglas County. But the thing that does not include a police is called STAR, and that's Support Team Assisted Response. So
Mm.
my point is this: you
Mm.
need to be careful about presuming, even though you seem to think that there's a tie to the federal government that made that word useful everywhere, but it's not.
Well, it's the Department of Justice briefs and white papers is where we got that from. But I
Well, you
hear
know
you.
how that goes.
I know how
So
that goes. Okay, so that's a good thing to resolve in comments. Yeah. Because we need to figure out something that is we
I
didn't
would
use.
just name it instead of giving it some, programmatic name that unfortunately is tied to something that's fluid, which apparently the Department of Justice is. So anyway, I would just, name things for what they are instead of what someone has decided
Non-law
to
enforcement's
tag them.
crisis response team. Going,
Well, that would probably be a good one.
that would be a good one. Comment registered. Thank you so much. That makes a lot of sense. Again, we tried. Yeah, that makes sense. Thank you. It is a non-law enforcement crisis response. But the one thing is, yeah. Oh dear. Okay. Okay. Thank you, Rob. Noted. And Rob, can I ask you a question? Is that one H-A-R-T or H-E-A-R-T?
I'm gonna copy what it says.
Okay.
The it's HEART. It's just like
H-E-A-R-T? It's
Mhm.
co-response? Wow. Oh, that's not the same thing.
No.
That's, oh, oh my Lord. Okay.
Yeah.
So
That's
that's not
why
even,
that's why having acronyms is dangerous.
acronyms is dangerous, but that's not even the same program at all. That's not just like
Right.
not
No.
co-response. Yeah.
Yeah, it's exactly what you don't want it to be.
Yeah, no kidding. Okay, thanks, Rob. Again, lit review completed, but not complete. Complete. You know, one of the things I love, Rob, is every time I search and it asks me if I want Vermont things. So my
Right.
guess is when you search, it offers you Colorado things.
Correct.
Okay. All right, we'll go back to the draw again. Thank you. Please submit, Rob, and you will, a comment regarding that, and we will fix it. Thank you. All right, food access concepts. I don't think there's anything here. No, this one's really stable. You guys made it stable. We're good there. Everything's on the master. Next slide. Yeah, that was it. Unchanging food access. Thank you so much. Then access to natural environment, which is again, we changed this because green space is not inclusive of the ways people access nature. And it was predominantly used only in urban environments because access to green space is an urban thing. We even felt like we were leaving out our desert friends who access spaces that are not green. So we stepped back given our domain was more inclusive. Next slide. Only new things are being presented. So far we have, okay, I'm just holding space. Rob, I know you're going to submit a spreadsheet with comments, but only new things are being presented here. Next slide. I think that's it. There's nothing new. Okay. All right, so I know some comments are coming in. Yes, we had a long talk, Mark, about nature and natural environment and why we're choosing one and not the other because of yes. The definitions as posted on the master help describe why because some of the green spaces in there's a lot. Yeah, we had Asha can testify. That was a good 45 minutes of conversation in this with Smeeze. You'll go spelunking. All right, here we go. Next slide. Okay, what? Well,
You're doing it.
we're doing it.
Yeah, what I just said, because Rob asked me, and I'm like, I don't know. So here you
Oh, here. Oh, yeah. Oh, great. I'm doing it. I am doing it, unbeknownst to myself. All right. Consensus voting. Who votes? The Gravity Project uses a consensus process to finalize project documentation and deliverables. Consensus is the value of HL7 and ANSI accredited organizations. So individuals are asked to join the project as a committed party or other interested party. So this is just like the cost of doing business. We need to be able to track how we create quorum. So subject matter experts vote, whether they be patient subject matter experts or they be in the content subject matter experts. Everyone else needs to lock in as a committed party, but we count everyone's votes, but quorum is established by committed parties. And Rob, on my 2026 roadmap, I have migrating to normative HL7 processes. I'm thinking about it. So we're going to, anyone can submit votes, but consensus is calculated based on the committed parties and SMEs. And so it's going to occur via poll. And if you want to attend but aren't able to, if you want to vote but you're not in the meeting, which is silly because you're all in the meeting, you can send an email to gravityproject@hl7.org. All right, next slide. Now we're going to talk about types of votes. And you've heard me talk about this a lot because certainly that heart thing is something that has to be resolved. And we'll figure it out. We have a meeting with the subject matter experts planned for the resolution of comments achieved during vote. And this is after the Thanksgiving holiday. So there's a yes vote. Yes does not necessarily mean that the deliverable is the ideal one from the purposes of the committed party or SME. But it's better to move forward than block the deliverable. Yes with comment. You've heard me mention that a lot today. If the consensus process attracts a significant amount of comments through yes with comments votes, it's expected that the comments will be addressed in a future revision of the deliverable. We also resolve, sometimes we resolve wording issues that are actually about wording and not meaning, and then present findings back to the next cycle in February on a regular basis and just make sure our dispositions resolve the concerns of the subject matter experts and the commenting entity. There's you send email comments to gravityproject@hl7.org by 11/27. You have a week. So you can vote yes, or you can vote formal objection. You have a week to submit your comment. Formal objections, the vote must include comments indicating a path to address the comment in a way that meets the objection in a way that meets the known concerns of other participants in the project. A formal objection without such comments will be considered an abstain vote. That's a lot of processy stuff. So if your formal objection at this point in juncture doesn't include a way to form a path towards a consensus, it flips to an abstain. Email comments to gravityproject@hl7.org by 11/27. And then abstaining is an individual declining to vote. So we talked about who votes, committed parties. So please sign up if you are not one, and you can do that on the Confluence, and then you can submit your vote later. And then types of votes: yes with comment, formal objection, and abstain. Okay. And then next slide. How we vote? You vote by, and I have it right here. Okay, I did it, Asha. I held it all meeting. You complete the Google poll form by tomorrow, 5 p.m. Pacific time, 8 p.m. Eastern Standard Time. And there's 3 things we're voting on. The food access master list. And so sometimes people have comments on just one thing. Like for instance, Rob, I'm going to call you in, my apologies. The comment on the HEART program, that's a comment on the neighborhood safety master list, right? So you can say whatever, and add a comment, and that comment will have to be resolved by us, and the comment has to be sent by 11/27, right? So there's a vote each for the food access master list, the neighborhood safety master list, the access to green space master list. Those are the domains. And then we always do a separate vote on any additions to the intervention framework. And those are those concepts that we talked about. So it's such a great robustness earlier. Develop and maintain in the community engagement. You have to press submit for answers to be recorded. And then you do, again, have to email your comments by 11/27. Just for surety, can folks try to open the link? Sometimes you have to click twice and see if they get the vote. Is everyone capturing the link? Everyone got it? Yay! Awesome. Okay, great. Okay, I just want to make sure everyone has it. Anyone having trouble? You can always email us and we'll send it to you. All right. Okay. And again, you're going to press submit to log your votes, and you're going to send comments if you have them by 11/27. Awesome, Lucy. Thank you. All right. Any other thoughts on this slide, which is a very procedural way to end 4 months of gorgeous collective labor, but it's what we do. Any other thoughts? Any other needs? Okay, next slide. Next slide. I don't even know if we updated this one, Asha. Again, man down. Next slide. Well, we do. Sarah Bahal did this because Sarah Bahal is amazing. Don't forget to submit your vote by Friday, November 21st. We'll keep on sending emails. I want to say thank you to all of you for your engagement and careful review and just wisdom as we do this amazing work together. We will miss you, and we will come back on February 5th. But I'll be sending emails and keeping in touch. And if you have anything that you need us to address, let us know and send in your comments. And just thanks, buds. Thank you for all the amazing work. Thank you to the terminology team. Sarah Bahal's not here today, but Susan and Asha and Sarah Bahal make the dream work. Monique's coming back in January. Thank you to all of you. Thank you to our subject matter experts. We are so grateful. And don't forget to submit your votes. We want all your votes commented, and I can't wait to read your comments. All right. Bye, friends.
Sarah,
Patricia's here.
thank you for giving us all a chance to participate in activities in Valhalla. I'm sure that nobody on this conversation ever thought they would get an opportunity to do that.
I can tell you what, Lucy, I am so happy to see content I create become real. I have done so much stuff, the pain assessment, the wound assessment, all those things that are not, I don't know who's using them. I don't know. So fun.
I know. And then for anyone, the affinity meeting was a big old using it meeting. I saw Asha's face. Bye, friends. See you.
Bye,
everybody. See you.
Thank
You're a
you.
Valkyrie.
Have a good holiday, Sarah.
Bye.
Take some time off, Sarah.
Yes.
You deserve it.